Strokes can be so traumatizing for the patients and the families. After a stroke, a lot of patients will suffer from a loss of language and even their cognitive abilities, their memory abilities. Aphasia is the sudden loss of language following a stroke. Aphasia can result in a patient having difficulty retrieving the word that they want to say. It can make it difficult for them to understand spoken language. It can even affect their reading and writing abilities. A vast majority of patients will make significant progress with their speech communication abilities following a stroke. This is all going to depend on the location and the size of the stroke and whether they have other health problems, but the majority of patients make significant progress. Strokes can frequently result in difficulty swallowing, and 30 to 50% of our patients, we will see some form of difficulty swallowing. Dysphagia is the medical term for difficulty swallowing. Here at the Medical Center, where we are a stroke certified hospital, we are able to provide you comprehensive evaluations during your stay and even provide further outpatient therapy upon your discharge, and you can even continue on with the same therapist frequently. So you have that continuity of care.